Hello viewers, today I will discuss my next case discussion topic on Radix Entomolaris. Now before going to my case discussion, first you have to know that what is Radix Entomolaris. There are two terms, one is Radix Entomolaris and one is Radix Paramolaris. Now if there is any kind of extra root is present on the distal aspect of a lower molar, it is known as Radix Entomolaris, and most commonly the distolingual root is considered as the extra root in Radix entomolaris cases, and another term is Radix palmolaris, where the extra root is present on the mesial aspect of a lower molar. And most commonly, the mesiobuccal root is considered as an extra root on the that is present on the mesial aspect of the lower molar, is known as Radix paramolaris. So today's discussion is on the topic of Radix entomolaris. Now, first, the clinical tips. Now, the first clinical tip is the access cavity. The, the most common failure of the radix entomolaris cases is because of inability to detect the distolingual orifice. Now, this is because of the inappropriate extension of the access cavity in your radix entomolaris cases. So, you have to extend properly the access cavity to detect this distolingual orifice, and in most cases of your radix entomolaris the distolingual orifice is away apart than that of your distobuccal orifice. That means in between in between this distolingual and distobuccal orifice there will be a significant distance. So don't miss the distolingual orifice. Now, in order to minimize the chances of error by missing the distolingual orifice, you need to extend the access cavity properly. You have to cut a little bit amount of extra tooth structure on the distolingual aspect. And two most important thing for the detection of distolingual orifice is, first you have to follow the dentinal groove, that is the dentinal map here in this picture, which will divide it into two sides. One is in buccal side, one is in the lingual side. So this division will give you an idea about two different orifices at a distance with each other. The next thing what you have to remember is the law of concentricity. I found the most useful law among all these six laws of access cavity preparation is the law of concentricity, which states that the wall of the pulp chamber, that is here this area, the walls of the pulp chamber should be in a concentric manner to the external surface of the tooth here, that is the external surface of the tooth at the level of CJ. So remember these two things, there is the law of concentricity and the follow the dentinal groove, that is the dentinal map outline. This will help to detect the distolingual orifice, thereby minimizing the chances of errors in your radix entomolaris cases. Now tip number 2, that is remember the curvature and long axis of the radix. Now before going to your root canal cases of radix entomolaris, if you see this picture on the left side, this is the distolingual root of this tooth. This is the distobuccal root and this is the mesial root. Now see this distolingual root. Mostly, I'm not saying in every cases, but most of the cases, the angulation of this distolingual root is away apart than that of your long axis of the crown. That means the long axis of the distolingual root is different that of your long axis of the crown, and most of the cases it contain a significant curvature in the distolingual root. That means remember this thing before you are preparing for the root canal of your radix entomolaris case, because This distolingual root, which will be finding during a root canal, has a significant curvature. It might contain significant curvature. It is an angulation to that of your crown. Now the tip number 3, anticipate the curvature and long axis of the radix. Now in tip number 2, I said that remember the curvature and long axis of the radix before your root canal procedure, and during your root canal procedure remember the tip number 3, that is anticipate the curvature and long axis of the radix. Now how will you anticipate? Now if you enter the initial apical file, that is your initial negotiation file. Okay, so if you enter into the canal, so if you reach the apex and remove the canal, remove the file from the canal. Now as in seen the right side picture, the working part of the file, this is the working part of the file. The working part of the file will clearly depicts the probable curvature and the anatomy of the canal. That means when you remove the initial negotiation file after reaching it on the apex, if you see the working part of the file, it will give you an idea, or it will give you a valuable information regarding the curvatures which is present in the canal. So by this way you can anticipate the curvature of the radix, that is your distolingual root. And now you have to anticipate the long axis of the root of your radix entomolaris, that is your distolingual root. Is when you place a file on the distolingual root, you will see the most of the cases the handle of the file will tilted towards the buccal side. I repeat, when you enter the file in your radix entomolaris cases in the distolingual root, the handle of the file will be tilted on the buccal aspect. Now that will give you an idea that how much the change in the long axis of the radix root is there in your root canal cases. Now it is similar to that of your upper molar. If you remember that while you doing a root canal in your upper molar, and when you insert a file in your disto buccal root, you remember the angulation of the handle of the file, it is tilted mesially, right? So in case of your radix entomolaris cases, you will see that when you place a file in the distolingual root, the handle of the file will be tilted on the buccal aspect. So that will give you a valuable information regarding the long axis of the radix. Now, third tip number 4 is pre-coronal flaring must. Obviously, pre-coronal flaring should be done in all cases in all the canals, but in case of your radix entomolaris cases, it is must, because remember the thing that in radix entomolaris cases the diameter of the canal is very narrow. There will be a different long axis of the root, as I say before. There will be probable curvature. Now all these points are aggravating the chances of the fracture of the file. Now after this, if you do not do a proper pre-coronal flaring, the chances of fracture will be more. So in this picture, if you see that you have to do a pre-coronal flaring to remove this dentin, that is the triangular amount, that is the triangular dentin or lip of dentin at the level of the orifice here, in order to minimize the stress concentration of your rotary files. So pre-coronal flaring, obviously in case of radix entomolaris cases in the distolingual root, in order to minimize the chances of fracture of the rotary files during your biomechanical or chemico-mechanical preparation. Now pre-coronal flaring is the job of your orifice shaper, which will shape your orifice, and as well as it will give pre-coronal flaring as well. So do a pre-coronal flaring in case of your radix entomolaris cases. Now the tip number 5 is the most important. Change the angulation of your endomotor while you are preparing the, especially in case of your radix entomolaris cases, the distolingual canal. Now, if you see this picture, this is the distolingual canal, which is in at an angle to that of your crown, different angle that of your crown. Now, on the left side picture, if you place the endomotor parallel to the walls of the pulp chamber, so the working part of the file will straightly go like this. Here in this point, it will get stuck, and then it will turn to the canal, and it will go up to the working length. So here will be a stress concentration point of your rotary file, which will increases the chances of fracture. So to minimizing the chances of fracture, don't uh, go to the parallel to the wall of the pulp chamber during your chemico-mechanical preparation. Rather, on the right side picture, slightly change the angulation of your endomotor so that the working part of the file, here you will see in the picture, the working part of the file is parallel to the root. So chances of stress concentration will be less, chances of fracture will be less. Now these are the tips, and now the cases of mine, of two of my cases of Radix Entomolaris. So this is the preoperative X-ray of tooth number 36, that is left lower first molar. Now if you see the X-ray, there is a caries present on the distal aspect approaching the distal pulp horn. If you see the pulp chamber, there is a calcification present on the pulp chamber here. The mesial root canals are visible, not clearly in the apical third, but in the middle third, yes, it is visible. In the coronal third is visible. Now, if you follow a shadow of the pedial space here, from here, then here, and then here, so there is a extra root. If you track the pedial space, there is an extra root. That is mostly there is a distolingual root. So it's a case of a Radix entomolaris because it is present on the distal side. Now this is the access cavity of that tooth. This is the mesiobuccal orifice. This is the distobuccal. This is the distolingual. This is the mesiolingual. This is the pre-endodontic buildup after removal of the caries by composite. And if you see the floor, you won't find any kind of groove because of the attached pulp stone on the floor here. Now if you see that, here is the distolingual orifice. So while I preparing a access cavity in this case, I have to cut some amount of extra tooth structure here. Otherwise, if I go from this mesiolingual orifice straight like this, I miss the distolingual orifice. So you have to cut a little bit extra from distolingual side in order to achieve, in order to find the distolingual orifice. Now this is the working length, mesial side, distolingual root, and this is the distobuccal root. Now this is the master cone X-ray of that tooth. This is 3004 on the distolingual. Here also 3004 gatapocha during the master cone X-ray. Now this is the picture of the after the obturation, access cavity picture of the after the obturation. So I removed the pulp stone with the help of the ultrasonic. Here the distolingual GP, distobuccal, mesiobuccal GP, and the mesiolingual GP. Now this is the X-ray after the obturation. Now if you see on the this is the distobuccal canal. In the apical third, there is some amount of sealer spread through the accessory canals. Here is the magnified image. You can appreciate that some amount of sealer spread to the accessory canals. Here also and here also. On the distolingual root also. So this is the distolingual GP, distobuccal GP, mesiolingual and mesiobuccal GP. This is another angulation of that case after the obturation. Mesiolingual mesiobuccal, distolingual, and distobuccal. Now this is the second case, and it is the right lower first molar, that is 4-6. If you see the X-ray preoperative, there is a caries present in the occlusal aspect of the tooth, involving the distal pulp horn and very near to the mesial pulp horn. Mesial root canal is quite visible from the orifice to the apex. Here is a large root canal you will see. Mostly it is associated with the distobuccal root. Here from the orifice, it is clearly visible to the apex. Now if you follow the pedial shadow, here is another shadow of pedial. This one is another shadow of pedial, and mostly it is an extra distal root. There is a distolingual root here. So it is another case of radix entomolaris. Now this is the obturation of this case. This is a mesial angulation radiograph. So this is the mesiolingual, that is the same lingual gadapercha. This is the mesiobuccal gadapercha. This is the distolingual gadapercha here, and this is the distobuccal. Now in this obturation radiograph, you will see that the length of the extra root, that is the distolingual root, is way shorter than that of your distobuccal root. This is a distobuccal root here, that is a 36% GP. Here also 36% GP, but the distolingual root I prepared till 34 because this is narrow, so I don't prepare much. So this is 34, and rest is distobuccal, mesiobuccal, and mesiolingual I prepared till 36 because these are wide canals. Now this is another angulation. It is extreme. I have taken extremely from the mesial angulation in order to separate two roots of distobuccal and distolingual. So this is the distolingual root. Here is the distolingual root. There is the distolingual GP, and this is the distobuccal. You see, distobuccal GP. This is the mesiolingual gadapercha, and this is the mesiobuccal gadapercha. Now, if you see in between two gadapercha, there is a ciliar penetration through the isthmus. That is basically the webs or fins, which are the thin channels between two main canals of the same root. So the ciliar spread in between the mesiolingual and the mesiobuccal canal. That means my hypoirrigation is good, so that the tissue dissolving property of the hypo act its best in order to penetrate the ciliar in between the mesiolingual and mesiobuccal gadapercha. So this is another angulation. There is a distal angulation. How beautiful it looks after the obturation. So this is all about my short case presentation on Radix Entomolaris. If you like this video and if you found useful, so please don't forget to like, follow, and subscribe for more videos like this. Thank you for watching. We will meet in the next video very soon. Thank you.